Would it surprise you to know that 8 out of 10 women will develop a uterine fibroid by the age of 50? That's right, 80% of women. Many don't even know they have them because they cause no symptoms at all. For others, fibroids can cause a range of uncomfortable and sometimes debilitating symptoms that can significantly impact their quality of life. In today's video, we're going to dive deep into everything you need to know about uterine fibroids. We'll talk about what they are, where they grow, and most importantly, the symptoms that you need to be aware of. And you'll definitely want to stick around to the end of this video where we'll reveal a highly effective non-surgical treatment for uterine fibroids that I bet you've probably never heard of before. And we'll explain why your OBGYN may not have ever mentioned it to you. So let's get started. Before we talk about fibroids, it's important to understand a little bit about the anatomy of the uterus itself. The uterus is made up of 3 distinct layers. The innermost layer is called the endometrium. This is the lining that builds up each month during your menstrual cycle and is shed during your period if your egg isn't fertilized. The middle layer is called the myometrium. This is the thick, muscular layer of the uterus. This is the largest layer. You can thank your myometrium for your menstrual cramps and contractions during labor. So your uterus basically is a huge, very strong muscle. The outermost layer of the uterus is called the serosal layer. This is a thin outer covering that protects the outside of the uterus. Now, here's the key point. Uterine fibroids grow from the myometrium, that thick muscular layer that we talked about. They're made up of smooth muscle cells and also fibrous connective tissue, so uterine fibroids are actually quite firm to touch. They're also referred to as leiomyomas or sometimes just called a myoma, and these are the most common non-cancerous tumors we see in women of reproductive age. We see them starting at about age 27 to 28, and they become more frequent as a woman gets older, close to menopause. So what exactly are uterine fibroids? Fibroids are benign, meaning non-cancerous growths that develop in or on the walls of the uterus. They can vary tremendously in size. Some fibroids are small and they can only be seen with a microscope, and others are huge, the size of a watermelon. In extreme cases, I've seen fibroids fill an entire abdominal cavity, making the woman look about 9 months pregnant. So some women have just one fibroid and others have multiple fibroids. Just this week, I saw a woman with over 25 fibroids in her uterus. Now let's talk about fibroids and cancer, because I know this is a big concern. So are fibroids cancerous? The answer is almost always no. Fibroids are benign in the vast majority of cases. In fact, malignant fibroids, which can develop into a type of cancer called a leiomyosarcoma, are extremely rare. The risk is approximately 1 in 10,000 fibroids. That's less than a 0.01% chance of having a malignant fibroid. There is one situation where you should be concerned though, and that's when a fibroid is growing after menopause. After menopause, your hormone levels drop significantly, and fibroids typically shrink or stay stable in size. So if a fibroid is growing after menopause, that's a huge red flag, and we want to investigate this further to rule out cancer. But for the vast majority of women, fibroids are completely benign and pose no risk to cancer. So now we'll talk about the locations and the types of fibroids. Not all fibroids are actually the same. They're classified based on where they are in relation to the uterus. This is important to understand because this can influence what symptoms you might experience and what treatment options might be best for you. There are 4 main types of fibroids. Intramural fibroids are the most common type. Intramural fibroids grow within that muscular wall of the uterus called the myometrium. They can cause the uterus to enlarge depending on the size and the number of the fibroids. They can cause heavy bleeding, pelvic pain, and pelvic pressure, especially as they get larger. The second kind of fibroid, called a submucosal fibroid, grow just beneath the inner lining of the uterus, the endometrial lining. They often bulge into the uterine cavity. Even though submucosal fibroids are often smaller than other types of fibroids, they tend to cause the most severe symptoms, particularly heavy bleeding. Because they're so close to the endometrial lining, they often disrupt the normal shedding process of the endometrial lining, which can lead to longer, heavier periods, as well as large blood clots. These types of fibroids are notorious for causing infertility and an increased risk of miscarriage. The third type of fibroid, called subserosal fibroids, grow on the outer surface of the uterus, under the serosal layer. Subserosal fibroids tend to grow outward into the pelvic cavity, and they typically are the largest type of fibroid. Because they grow outward rather than inward, they usually don't cause heavy bleeding, but they can cause significant pelvic pressure, back pain, and a lot of bloating because of the size of the fibroid. If they get large enough, they can press on nearby organs like the bowel or the bladder, leading to frequent urination and sometimes even constipation. The last type of fibroid we'll talk about today is called a pedunculated fibroid, and these are the least common type. Pedunculated fibroids are attached to the uterus by a thin stalk or a stem, kind of like a mushroom. They can be either submucosal on the inside lining of the uterus or on the outside of the uterus, kind of like growing like a tree. So now let's talk about fibroid symptoms. It's important to remember that many women with fibroids experience no symptoms at all. In fact, about 50% of women with fibroids are completely asymptomatic. When symptoms do occur, they can range from mild to extreme, and they can significantly impact your quality of life. The symptoms you experience largely depends on the size, location, and the number of fibroids that you have. So let's walk you through what a lot of women experience. By far, the most common symptom is heavy menstrual bleeding. Bleeding so severe that women are wearing pads and tampons at the same time, requiring changes every 60 to 90 minutes. Many women also experience huge blood clots, sometimes as big as their fist. Blood clots can develop because the fibroids interfere with the normal contractions of the uterus and the normal shedding process of the endometrial lining. In addition to heavy flow, a lot of women experience periods that can last up to 7 to 10 days or have bleeding between periods. It gets so bad for some women that they literally don't even like to leave their house during their menstrual cycle. Now, here's something really important to understand. When you're losing that much blood month after month, it can lead to a condition called anemia, which are low red blood cell count or low hemoglobin. Your body's losing more red blood cells than it can replenish due to that chronic blood loss. Anemia brings its own set of problems, including fatigue, weakness, dizziness, and sometimes even shortness of breath, and in really bad cases, heart palpitations. Anemia can feel like you're trying to exercise in the mountains when your blood can't carry enough oxygen to your tissues. Beyond bleeding, the second most common symptom is pelvic pain and pelvic pressure. You might feel a constant sense of fullness or heaviness or pressure in the lower abdomen or pelvis. This can range from a dull ache to sharp stabbing pains. The pain can be constant or sometimes it can come and go, and it's often worse during your menstrual cycle. Some women describe it as feeling like there's a constant heaviness or something sitting inside their pelvis. This pressure can also radiate to other areas of your body. When fibroids grow in the backside of the uterus and get large enough, they can compress nerves and muscles in the lower back, causing chronic lower back pain. In some cases, fibroids can even press on the nerves on the floor of the pelvis and shoot pain down the legs or sometimes into your buttocks. So if you have unexplained back or leg pain, fibroids could actually be the culprit. The pressure from fibroids can also affect nearby organs. If a fibroid is actually pressing on your bladder, it might feel like you want to urinate all the time, even if your bladder isn't full. You might also wake up multiple times during the night to urinate, which can be exhausting. In some cases, fibroids can make it difficult to completely empty your bladder, which can increase the risk of urinary tract infections. Similarly, fibroids can compress the bowel, leading to chronic constipation, difficulty passing stool, or a feeling of rectal pressure. You might also experience a lot of bloating or a feeling of fullness in your abdomen. Large fibroids can actually make your belly protrude or make it look swollen, making you look 3 to 4 months pregnant. This, of course, can be extremely uncomfortable. A lot of women complain that they just can never find clothes to fit them anymore. For some women, fibroids also affect intimacy. Depending on the location of the fibroids, you might actually experience pain or discomfort during or after sex. Finally, let's talk about a huge topic, and this is fertility. A lot of women experience huge fertility issues with fibroids. A lot of women with fibroids get pregnant and have no issues at all. But with submucosal fibroids, these can actually interfere with the implantation of the embryo or increase the risk of miscarriage. So if you get pregnant with fibroids, they can actually increase the risk of complications as well, like placental abruption, preterm labor, or the need for a C-section. So if you're experiencing any of these symptoms, whether it's the heavy bleeding, the pain, the pelvic pressure, or other issues that we've discussed, it's really important to talk to your doctor. A proper diagnosis typically involves a pelvic exam and imaging studies like an ultrasound or an MRI. Don't just suffer in silence thinking that this is all normal. These symptoms are extremely common, but they're not something you have to live with. Now let's talk about the treatment option that we promised at the beginning of this video, one that you've probably never heard of. This is called Uterine Fibroid Embolization, or UFE for short. UFE is a minimally invasive, non-surgical procedure that's been used successfully for over 25 years to treat symptomatic fibroids. It's a highly effective, has a quick recovery time, and preserves the uterus. So it's an excellent option for women who don't want to go through a major surgery like hysterectomy or myomectomy. So how does this procedure work? This procedure can only be performed by a specialist called a vascular and interventional radiologist. This is not performed by your OBGYN. This is likely one of the main reasons why you've never heard of this. Your OBGYN may not also be familiar with this procedure or might not often refer for it. During the UFE procedure, a tiny incision is made at your groin, about the size of a pinhole, so it's really small. Next, we insert a thin, flexible tube called a catheter into a blood vessel. Using real-time X-ray imaging like the machine that you see behind me here, the catheter is carefully guided through the blood vessels to the uterine arteries, which supply blood to your fibroids. Once the catheter is in place, we inject tiny particles about the size of a grain of sand into the arteries supplying blood to your fibroids. These particles block the blood flow to the fibroids. Without blood supply, fibroids cannot survive and they start to die. Over 6 to 12 months, the fibroids shrink naturally on their own, typically about 40 to 60% in size, and they also soften to the point you'll never feel them again, depending on the size of the fibroid initially. Most women see improvement within 2 to 6 weeks, and your symptoms should greatly improve or resolve completely within 3 to 6 months post-treatment. The entire procedure usually only takes about 45 minutes to an hour, and it's done as an in-office outpatient procedure, meaning you go home the same day. Patients are given IV twilight sedation to keep them comfortable during the procedure. Most women experience no pain at all during the procedure. After the procedure, most women experience uterine cramping, which is the most significant side effect, and discomfort for a few days, but this is managed with pain medications and anti-inflammatories. The cramps are typically the worst the first 24 hours post-procedure and get better pretty quick after the first day. The recovery time is much shorter compared to surgery. Most women are back to their normal activities and back to work in less than a week. One of the biggest advantages of UFE is that it preserves the uterus, so pregnancy is still possible after UFE. UFE also treats all fibroids at the same time, regardless of their size, number, or location in the uterus, which is a major benefit compared to surgical options that may only remove the fibroids that the surgeon can see or that the surgeon can get to safely. The success rate of UFE is extremely high. Studies show that more than 90% of women experience significant or complete resolution of their symptoms, and the satisfaction rate is excellent. Since the access with UFE is so small, again, about the size of a pinhole, risk factors such as infection, bleeding, and tissue damage are extremely rare. So if you're suffering from fibroid symptoms and you want to avoid a hysterectomy or a major surgery, UFE is definitely worth discussing with your doctor. And if your OBGYN isn't familiar with it, you can ask for a referral to a vascular and interventional radiologist in your area. I hope this video has given you a comprehensive understanding about uterine fibroids, what they are, where they grow, the symptoms they cause, and most importantly, that there is an effective non-surgical treatment option available with UFE. Remember, if you're experiencing heavy menstrual bleeding, pelvic pain, frequent urination, or any of the other symptoms that we've discussed in this video today, don't just suffer in silence. This isn't normal. Talk to your doctor, get a proper diagnosis, and make sure you're aware of all of your treatment options, including UFE. Thank you for watching. I hope you've learned something today. We have other videos on this channel that go into even more detail about treatment options for uterine fibroids, including natural remedies that may help you manage your symptoms. So be sure to check those out as well. If you found this video helpful, please give it a thumbs up and hit that subscribe button so you don't miss more of our new videos. I'd love to hear about your fibroid journey and what treatments you've been recommended, so please share in the comments below. We're here to provide you with accurate, evidence-based information to help you make the best decisions for your health. Thanks so much for watching, and we'll see you in the next video.